Nurse Practitioner Autonomy, a solution to improving access to healthcare in Missouri. My name is Becky Captain, and I'm a Missouri family nurse practitioner. United States Health and Human Services has designated 80% of Missouri as a healthcare provider shortage area. 80%, that means that there's less than one primary care provider per 3,000 Missouri citizens. Additionally, that means that individuals can drive more than 30 minutes before they can have any primary care access. Specifically for Missouri citizens, that means 1 in 5 Missourians do not have access to primary care. The Affordable Care Act focuses really well on increasing insurance for the United States citizens, including Missouri citizens. But if we had the same amount of providers and more people with health insurance, it doesn't mean that it's going to increase access if they can't get in to see their provider. So we really need to optimize the providers that we do have in Missouri, reduce any restrictions on those providers so we can optimize their time and have more patients be seen. Additionally, the Commonwealth Fund is an independent and private foundation that measures 38 health indicators and compares the states on these health indicators. Missouri in 2007 was ranked number 31, and now it's 36 in regards to health care access, avoidable hospitalization use and avoidable hospitalization costs, healthy living and population, and prevention therapies. Nurse practitioners' education is 4 years of nursing. They are a nurse first, so they have 4 years of undergraduate studies, and they get their Bachelor of Science in Nursing. After that, they go on to an accredited graduate program. Either it's a Master of Science in Nursing or a Doctorate of Nursing Practice, which is approximately additional 3 years. So nurse practitioners will have a total of 7 years of college, which is equivalent to that of a lawyer, a chiropractor, an optometrist, or dentist. Nurse practitioners provide primary care in the state of Missouri by completing extensive health histories, completing comprehensive physical exams, treating acute and chronic illnesses, prescribing and managing medications, ordering and interpreting diagnostic tests and laboratory tests, and providing health education to our Missouri population. In the state of Missouri, a nurse practitioner has to have a collaborative practice agreement with a physician in order to practice. So one, we have to have a physician in order to even be able to provide any access to care. In addition to that, within that collaborative practice agreement, there are restrictions. For instance, a nurse practitioner cannot practice beyond a 30 to 50 mile radius of that collaborative practice physician. What that means to Missourians is in May of 2011, when the deadly tornado hit Joplin, it was devastating. It killed 158 people, injured over 1,100, and demolished at least 2,000 buildings. There was pleas for healthcare providers to come and help the survivors. And these were our patients, our extended family, our friends of friends, and many nurse practitioners couldn't help because they were outside their 30 to 50 mile radius. So it's hard. We're restricting nurse practitioners where we can't even help our own citizens in a state of emergency. In addition to that restriction, we have to work 30 days with our collaborative practice agreement. So let's say a nurse practitioner has had a practice for 10 years, and that collaborative practice physician resigns, retires, leaves, takes a job elsewhere. That nurse practitioner has to put his or her practice on hold get a new collaborative practice physician and practice with them for 30 days before they can continue their current practice. In addition to that, when we talk about rural Missouri, and we have lack of healthcare providers in rural Missouri, physicians can only have 3 contracts with nurse practitioners. So if we lack a provider in rural Missouri, we don't have enough providers there, and then when we do have one, they can only have 3 nurse practitioners in that area. So we're restricting access, and we're restricting the capabilities of our nurse practitioners. There's been numerous studies that state that nurse practitioners have high patient satisfaction, increased patient compliance, and quality outcomes with similar patients equivalent to that of physicians. So having safety concerns by removing the collaborative practice agreement is completely unfounded. There are currently 16 states in the District of Columbia that have reduced all supervision by physicians and collaborative practice agreement to nurse practitioners. Nurse practitioners financially could help the state of Missouri. In fact, they've been known to reduce hospital length of stay, reduce readmissions, and reduce the use of emergency rooms for non-emergent visits. In addition to that, it's estimated that by removing the collaborative practice agreement mandate for nurse practitioners, that the state of Missouri will reduce their health care costs by $1.6 billion in the next 10 years. I am advocating for removal of the collaborative practice agreement mandate for nurse practitioners in the state of Missouri. I urge all Missouri citizens to write their state legislators, talk to their state legislators to remove this mandate. I also encourage all state legislators to take action in removing this mandate, because by doing this, we are improving access to our Missouri citizens. We are providing high quality care, adding quality of life, saving lives. And over the next 10 years, we will be reducing healthcare costs in the state of Missouri by $1.6 billion.